All right, thank you so much for joining us again today. My name's Kelly. I'm here with Camille, and we have Moira, our special guest today. I am a certified behavior consultant. Camille, would you like to introduce yourself as well?
I'm Camille Osmer. Kelly and I are both from the North Carolina area, and we are both certified dog behavior consultants. And we both specialize pretty much in behavior and working with behavior cases.
And apparently words are difficult because I was struggling with words in the intro today talking to them. So just, thanks for hanging with us.
Yeah,
Moira,
that's right.
would you like to introduce yourself?
Sure. It's first of all, thank you so much for inviting me. I'm super happy to be here. I know it took us a little bit of time, back and forth, but we made it happen. I knew we were going to eventually. I am Moira, for the ones of you who don't know me. Moira Hechenleitner. I know it's a weird and a mouthful, so you can just remember me by Moira. I'm a veterinarian and I'm a certified separation anxiety trainer. I've been working exclusively with separation anxiety cases since 2017. And I work both in English and Spanish, and I take cases all around the world since this is something that we do virtually. And I'm based in the US in the East Coast in Mystic, Connecticut right now.
We are so excited you're here with us today. Thank you so much for being here.
And I'm really glad that we wrote down the questions we're going to ask because even from your introduction, I'm like, oh, I have a question. Oh, I have a question. Oh, I have a question.
Right.
That's good. Let's go back to our
rabbit hole. There's no problem with that. I love rabbit holes.
I know. Oh my gosh, it's gonna be fun. Okay, so we'll get started with just what does separation anxiety mean to you?
That's a great question. And I mean, I don't want to say it has changed over the years because, of course, the foundation of it is the same in terms of the answer. But I have sort of developed a system of how to address this question. And I have also thought more about it or reflect more about it over the years. So the way I like to define this is basically as an irrational fear of being left alone. So for a dog who suffers from separation anxiety, they are basically experiencing a stress response when they are exposed to being left alone. And why do I call this irrational fear? We actually could say that because it's an irrational fear, it's also a phobia. And there's a lot of controversy around that word, right? But why could we say that? Because an irrational fear or a phobia is basically when someone is exposed to the same stimulus over and over, and instead of realizing that it's not a life-threatening situation, they continue to do so. And so they continue to show or elicit a stress response in response to the situation that they're exposed to. And this is the case with separation anxiety. The more you expose a dog to being left alone, the dog doesn't understand that, okay, I'm cool, I didn't die, this is okay, you're gonna come back, I'm gonna be okay. Rather, what they do is they continue to react to it, and usually they escalate over time. So that's basically it. And another way that I like to define this is basically that since this is an aversive stimulus for the dog will really try to cope with it when he's exposed to it, but at some point they're going to reach a point of no return. They're going to reach a point where they can't handle it anymore. You will start seeing more overt signs of distress rather than the typical displacement signals, such as shaking off or pacing or yawning, licking their lips. You will start seeing, vocalizations, destruction of objects, elimination, and so on. And from that point on, if you don't remove that stimulus, they will continue to do it until it's removed. And it usually what's gonna happen is that this displaying of the signs is going to be either cyclical over time, or it's going to escalate in intensity and frequency. And when I say cyclical, it means that if you leave that dog alone for 8 hours, the dog will cycle through the signs and may stop and look like somewhat he's settled maybe for a couple of minutes, and then he will or they will resume and will continue to do so until someone is back.
Your description is so in depth, and you can tell that you've been asked so many follow-up questions in your description that you're already beating to the chase. It's like, oh, don't even, I got you. That was beautiful.
I know what you're gonna ask next.
So I have a question because to me, separation anxiety is one of the harder things that I work with. I'm not, you know how you get in tune with some things as a trainer and you're like, okay, I got this down pat. I love it. I know I can help people with it. Separation anxiety, I know I can do, but it's not one of those things I've ever been drawn to. What about it drew you to it as opposed to, reactivity or, any of the other problems that we have in behavior?
Exactly what you mentioned. So I used to do different types of behavior, work on different types of behavior. I was in Chile back then. I had a company with a colleague, a dog training company. And although I got separation anxiety cases once in a while, I always felt like I wasn't really giving them the answer to their questions. And we would start working, and I would unconsciously or a little bit consciously would try to sort of cover all of the other things that they were asking, but this one give a little bit of advice, and I felt like I never really was able to solve it, or I don't know if solve is a good way of putting it, but I never was able to address it fully or to help them. And I kept reading all of these books, and following the typical list of things that you were supposed to do when you were dealing with separation anxiety, and none of them really worked. So I felt like there was a hole in my knowledge or in my tools to deal with the situation. And at some point I sold my company, and I decided that I wanted to move, and I decided that I wanted to be able to work online as well, to have more freedom to be in different places. And that's why, those are the two main reasons why I started with this process. Now, once I did become a certified separation anxiety trainer, I realized that it was meant for me for other reasons as well. And one of those main reasons was that it is, although all of the different types of behaviors that we address as trainers are really about the human side of things mostly, I felt like this particular area of work was truly about the human part of things, because I don't really see the dog live. I'm never with the dog. I never meet the dog. The dog never knows me, and maybe they know my voice and that's it. So, and I actually like that. I like that very much. I really like to connect with other people and to work through their challenges, and that really caught me. So since then I've been doing it.
Nice.
I've never
I do love the freedom that it gives you to be able to work virtually, and honestly the reach that it lets you help other people so far away. It's amazing. I love that part of virtual. I think it's wonderful.
Definitely. And it's funny because we used to work virtually much earlier than the pandemic and when everybody started doing virtual. And we had to convince people to believe us that this was actually going to work, because the truth is that with separation anxiety, you benefit from a virtual approach, because you're not there
sure do.
to affect the natural flow of the situation, right? The person doesn't in reality doesn't leave with the trainer when they leave to do their things, right? They leave on their own. So you want the dog to understand that that is a nice and an okay setup. And also you're able to observe the body language in depth much more than if you were there, right? Because you what you want to see is what happens when you're not there, basically, and what is the dog doing. So we used to do it virtual all the time, and we had to convince people. And then after the pandemic, it became much easier, because everybody learned how to use Zoom, and it was more like a normal thing. However, lately I have been getting these cases where people, now that everything kind of came back to in person and people are more drawn to, I want to see people, for real, and I want people to come to me. They are starting to ask the same questions again, and I have had to revisit this explanation once more and explain to them, no, it's separation anxiety has always been like this. It's not due to the pandemic. It's how we do it.
Well, and I think it's hard for our clients to understand that just our presence can sometimes change the whole dynamic, and it's not often doesn't help in training. But yet if we can let them do their thing, and like I have a separation anxiety client that I watch their live cams while they're gone. I watch their dog, and wow, that is so much great information. But some people just don't, maybe they're not used to Zoom or the whole virtual thing, or they want it to go away since they want COVID to go away. But it's hard to explain the value in us not being there. You know
And
what I mean?
I definitely, and I think that it's really about us as trainers, as a community, to it's our role to communicate and to educate our clients about that, because I think it's just because they don't know, and they think it might be better if we are there in person and if we actually meet their dog. But once you explain, they're like, oh, I never thought about that. That makes a lot of sense. And I imagine, I don't know anything about aggression. I don't do any of that, but you guys
Don't
do.
say that. You know more about aggression than you're
You
voting off.
do.
Many years have passed since I knew anything, so probably a little bit outdated in that regard. I don't really like it. So, but I'm sure that in your case, there's also some cases that would benefit from you not being there, right? If the dog is
Absolutely.
very reactive, the dog is very fearful, you might want to get out of the picture so you can really make progress, and maybe later down the road you can add that part to the equation. So yeah, I think it's a valuable tool to work
We
on
say
that.
the same thing that you say, in the sense of, we don't need to see the problem behavior. It's better if we don't see the problem behavior. Keep that, like, we want to avoid that. So yeah, virtual absolutely does help with that.
Another
It can
thing
be
clients want us to
boring.
see, they want us to see the dog do the
I
behavior. I'm like,
hate that
no, I'm
line.
good, thanks. I
Yeah.
believe you. You wouldn't have called
Let
me if
me
you didn't
show
need us,
you.
right?
I always lead with that. This needs to be very boring. It's
Mhm.
boring. You
Yes.
need to see
Oh,
a dog
nice.
like that. That's what I want. Boring. That's my jam.
Awesome. You brought
I
up the
like that.
pandemic. I'm wondering, because I feel like I heard this term after the pandemic, and it makes sense in the sense we saw a lot of, and correct me if you, or I just, the term that I learned was separation related anxieties. And it was, I think, and I remember, I don't know if I heard it from you or another trainer, but it was someone's way of saying, well, we're seeing a lot of dogs show a lot of conflict with separation now, but it's not full blown phobia.
Yes, and this is an amazing question, and I think it's I don't know if it's a rabbit hole, but it is definitely something that is muddy. And so I love that you asked this, because I really want to talk about it. I was looking forward to it. So what happens is that first, I believe there's no standardization of the terminology in the dog training field, not only within a country, but between countries.
Yeah.
So everybody might be saying the same thing, but they say it in different ways. And it's very confusing, because you don't really know what the person's trying to say when they, name something in a certain way. And I believe, and I agree that with the pandemic, we started seeing so many cases that look like something with separation, right? We didn't know what, but something was going on when people started to go back to work and leave their dogs alone, or when they adopted dogs and they were, leaving them for just a little bit of time, they started seeing weird things happening. And so to really standardize the concepts, and so people understand better what they're dealing with, which is the most important part of defining all of these little aspects. Let's think about separation-related behaviors as our umbrella. And before, we used to call the separation-related problems. But problem is a very controversial word that personally I don't like, because who has the problem? Sometimes the problem is not the dog. The problem is that you don't like what the dog is doing, right? And sometimes it's not a problem, it's a challenge. Like if you are going to therapy and you're going through a challenge, it's a challenge, not a problem, right? So separation related behaviors, that is our big umbrella. And those can be defined as all the behaviors that a dog displays when left alone that are undesirable either for the dog and or for the guardian. And that can include a lot of things, right? Non-specific things such as barking, crying, destroying things, eliminating, trying to escape, and so on. The thing, though, is that all of those things can happen for a lot of different reasons. So the underlying cause for those behaviors could be many. And that's how we try and we start unpacking all those different causes. And those causes can include, for example, the dog is adapting to be left alone. That means that they have the tools, they know how to use them. The way I like to think about separation anxiety is that the dog has the tools, but doesn't know how to use them to cope with adapting to something new that is scary. And through training, you teach them to develop those tools or to learn how to use them. So there are many cases, and a lot of them happened during the pandemic, where they would adopt a dog, people would adopt a dog, and the dog was never left alone. And so they really never learned how to do it. But it's not that they didn't know how to do it or they didn't have the capability to do it. It's just they didn't know. So it looked ugly the first times they were left alone. They might cry and do a few behaviors that look like they were in distress. But over time, they were able to relax. So that could be a reason for a separation-related behavior. It could be that the dog hasn't learned how to go potty in a place that you designed for them to do so, that they have learned that your pillow isn't a toy. It could be that the dog has a lot of energy and you are not fulfilling the dog's needs. It could be that the breed isn't, matching the setup that you're providing for them, or that you're leaving them too many hours alone. It could be confinement issues. It could be alert barking. It could be noise sensitivity. It happens that there are storms and your dog has, noise sensitivity to storms, and then he happened to be left alone, for example. And it could also be separation anxiety. The reason why I go so in depth with this is because I believe this is the most important. If people who are out there listening to us are gonna remember something, remember this. Why? Because the reason why we assess to determine if a dog is suffering from separation anxiety is exactly due to this. We need to determine which one of this is, because all of them will approach differently. Some may approach the same. And yeah, if you do a training program for separation anxiety, you may be able to resolve many of these. But do you need to? Because it's life consuming, right? And in our responsibility as trainers is to provide with the tools that are the easiest and the less, lifetime consuming for the guardians so they can be successful. So if I don't need to implement a huge training program that usually new is really like to, because we want to practice and we're happy and we want to do it, we don't have to, right? We can do something much easier than that. And so once you determine which one it is, then you address it accordingly.
The power of that. I mean, Camille,
Yeah.
do you remember, like, because I know I never wanted to be a CSTATI because I'm not a patient person. I am just really, I admire what you have. And the way you said, the dogs already have the tools. I have been saying we need to teach the dogs the tools. So I like your perspective. I know I want to
love that you
swallow
said
that
that.
and hang out with it for a while to see how I'm going to apply that, because that's beautiful. But Camille, you remember separation anxiety used to be, you must do it this way and this way and this way. And Moira, that was so amazing how that's the one thing that's driving me nuts in the dog training world. And I talk about this with Camille all the time, in the sense of everyone says there must be one way of doing it and you can't use food and you can't do this. And like, you're like, no, the person's the one doing it. So I need to make the plan match them. And that was awesome.
Yeah, that's
It's
really
about
neat.
empathy, right? And it's about, of course, you also have to advocate for the dog. So if the dog really needs it, you have to communicate that. But if the dog doesn't need it and it's still going to be able to be successful, and it's more likely to be successful if the person actually commits to it, you need to create a balance. And that balance happens when you listen, which is one of the main things I've been focusing lately in really thinking about it. And the importance of listening, both the dog and the client, to understand where they're coming from with all of the things that they're living. So yeah, I usually don't use food. I will suspend absences in 99.7% of the cases, but I have made different accommodations depending on the case, depending on what they're living. And my I guess safety card, I don't know how to say it, but I have a little thing there that I mentioned. Look, we have this data tracking, and that's what I love about separation anxiety. I'm very OCD. I love to have everything objectively organized. And so I love having this data tracking sheet and all of this following, like following our training by written, because that allows me to see if what we're doing is working. So instead of guessing and instead of saying, okay, you do this and maybe it will work and we'll see, we say, okay, I'll allow you to do this and let's do it for a week. If our trend gets better, cool, it's working. If once we introduce this, the trend goes downhill, it means it didn't work and we have to think about something else. If it didn't affect anything, cool, we can continue doing it and keep an eye on things. So it's not about what I believe, it's about what we're seeing. And that really helps people understand that what they are doing, it actually makes sense. And it's not just because I say so.
That is awesome. I wanted to ask you about food, but Camille, do you have any other questions before I jump into that question?
Hey, food's a really good question too. I like that one. No, I really like the way you presented that, Moira. I have a client now that came from a CSAT and had to change to me because I was covered under, because Kelly and I work for the veterinary behaviorist here. And so it made their insurance be able to pay for the training that they needed for separation anxiety. But they had such a beautiful start from the CSAT that they worked with that I hate to say we made a lot of progress, and I want to like call their CSAT and say, hey, by the way, you did such a great job. This is easy. But they're the most dedicated. I love the ladies make their own charts, and I assume it came from their original CSAT trainer. But you were talking about the data collection, and they have their own charts, and they tell me exactly what they did in their missions, and they make up their missions. But I kind of tweak them and say, hey, let's try this, and let's push a little bit harder, and it's just gone so beautifully. But I really, really appreciate that a CSAT started with them, because I think she taught them the value of virtual training. She taught them the value of the details and the and watching their dog and understanding the body language. It's been a real joy to work with them. I've really enjoyed it.
We have amazing clients, and I think that is across the board with separation anxiety. We have the most amazing clients. Ask any CSAT, they will tell you.
Yeah.
They're just so committed. And I don't know if that's because the people who aren't ready to be committed yet don't embark in it. And that's why
Right.
we get to see the people who are already have decided to commit to it, maybe. But I really think that when you start by showing them that this is the power of this has power, and we can do a lot of things with this, they really
Right.
learn that it works, and they really learn what's very beautiful. And I'm sure that with aggression or reactivity, it must be similar in certain ways. They really learn about their dogs. They learn so well about how their dogs move and what it means. And there are times
Yes.
that we brainstorm together. I have clients who have been working for years, and we brainstorm. We saw that's weird. Why was this happening? Oh, maybe it was because of this or that. And it's so cool to see how engaged they are and committed they are to their dog, and learning and listening to them. That's right.
I
It
think
is
that
very neat.
absolutely. Well, because like I used to think that I didn't have good clients, but it was me. Like I used to, I wasn't teaching appropriately or well, or I held them to higher expectations than I should have. So I wonder if, and Camille, I'm interested to hear your input too, because I think the more I do this, the more I feel like I have some great clients. And I say goodbye to the ones I know don't want to do my plan. So I'm able to say goodbye quicker.
Yeah, it does make the goodbye a little easier, because you're like, it's like you can give them all the tools. You can give your clients every tool possible to help them succeed. But if they don't use them, like if you have a client that doesn't practice, for example, or whatever it is, it's self-defeating, I think.
Mm-hmm.
So it does make it easier to say goodbye to them. But the ones that work, and that you give them the tools and they do it, and you're like, isn't this fantastic? It's so positively reinforcing.
I feel like one of the hardest things, I don't know if you ever do this, Moira, is investing more in the training plan than the client.
Investing, excuse me?
More
Yeah.
into like more of yourself into the training plan than the actual client's doing.
In this particular case, I feel like I don't get that. So, and that's one of the things I was going to mention after what you were saying, is that I feel like we are lucky because the training looks so imposing. Like, so in a way, it looks difficult because there's so these sheets and all of these things that we have to, follow up with and write down, that I feel like people who aren't ready look at it and there's no. And so maybe they last a month and they then continue on their own. And I know the ones who are going to continue and the ones who are not likely to. And so I don't feel like I'm more invested than them, because it's really the ones who stay are as invested as me, basically.
Mhm.
And it sounded like you're able to see signs that it's like, okay, I think I'm gonna stop giving you energy because you stop putting energy into the plan too.
Yeah, and I think you feel, and I have seen this across the board with other fields, not only in dog training. I feel like you as a person who is being of service, you're providing a service, you're helping, you feel more motivated when people are motivated, right?
Yes.
When people are motivated,
Yes.
you start losing your motivation. We're humans. No matter how professional we want to be, it's still going to happen. Like if you go to the gym, for example, and have a coach and you're asking questions and you want to train and you want to, get better, they're going to be super into you because they are having a good time with you, right? Because that's their job, to teach you, and they're happy to do so. But if you go there and it's like, I don't want to do anything today, I want to finish this, oh, this is boring, I want to go, they're going to end up just giving you the default thing to do, and that's it, probably, right? Because it's not fun to train you. So that
It's a great example.
Social learning, it's so powerful. And I don't know if you guys, I'm gonna pull it up again, but Sarah Stremming's recent podcast, she interviewed a doctor and they were saying that dogs learning processes are more similar to humans than chimpanzees learning processes are. And
Wow.
it's that social component.
Has it developed that way over time, or is it?
Into it because I don't want to cut her words apart. But the
Okay,
one point I took
interesting.
out of that podcast was we have more similarities in dogs learning processes than we do with chimpanzees learning processes.
I've
And
heard a lot of that too. A lot
they
of those
talked about the social
comparisons that are
process.
closer. Yeah,
Yeah.
Very
interesting.
interesting. I didn't know
Yeah.
that. But makes a lot of sense though once you start thinking about it. Wow,
I've been having these arguments with people all the time because about how I'm like, no, but I see dogs make more sense. I watched Chimp Empire and it made no sense. They cared about dominance, they cared about hierarchy. That's like half of their life. And we don't work that way. Well, most of us shouldn't work that way.
Definitely, definitely. Yeah, that makes a lot of sense. I do give a lot of examples in my line of work about humans.
Mhm.
Most of the time I'm giving examples about things that people relate to. Like if the person plays an instrument, we talk about how that, unfolds, to give examples about how the dog learns. Or if the people are good at sports, I give analogies about sports.
Mhm.
But it's interesting because, yeah, right, I am constantly coming back to humans and how they learn and how they process and how it is for them emotionally, and how that is similar to dogs. So that's very interesting.
Yeah.
I love that.
It's empathy, right? I feel like we were talking about this, that you just need some empathy when you do this job because you have to kind of be able to put yourself in their shoes, and dogs make it easy to do
Oh, I
that.
think so too. Yeah, I definitely think so.
Yeah.
Um, but I do have to help, get us to circle back around to food because I'm dying to know what Moira says about food. I know how I use it, and I know, sometimes I try it and it doesn't work. Okay, we're going to put that aside and we're going to do it this way. And what's
Yeah.
your take on that? Or Kelly, maybe you wanted to say it differently.
No, that's exactly.
Okay.
We all know we've been taught from beginning of dog training that if you're doing separation anxiety, you do not use food. It
Right.
distracts them from the process.
And
So
I'm going to tell you why, in a way that when I say it, a lot of people move their head and it's like, oh yeah, that's true. And it's so easy. So when you want to make a positive association with something that's aversive, what do you usually do? You present the aversive and then you present something that's positive, right? So every time that this kid appears in view and I am afraid of kids, I get the thing that I love the most. Oh, I guess kids are cool, right? But when you give food and separation anxiety, what do you usually do? You give a con
Mhm.
and then you leave.
First,
Because you
the
can't give it
order.
after, right? Unless you have a remote feeder, you can't give it after. You have to give it before you leave. So every time this tasty thing appears, I'm gonna leave you alone and you're gonna be terrorized. And so what happens? Food means bad things are going to happen. And if you think about that, just that, technically it doesn't work because the order is incorrect.
Mhm.
And that's the main biggest reason why I wouldn't use food for that purpose. Now, there are more reasons. Another reason is because if the dog eats the food, which many don't, but if the dog eats the food, it works as a distraction. So what happens is it muddies your observation of when the dog is not okay anymore. Because the dog will eat the food and they will finish the food and then they will react. And you don't know if that food hadn't been there, if the dog would have started reacting much earlier. So your plan can't be tweaked accordingly because you don't have an objective measure of what was happening in that situation or what would have happened. And that represents a problem, right? Another thing that I've seen in my experience doing it, more than the technical aspects, is that when the dog is eating, what happens if you're doing it in a supervised setup? So you're not leaving the dog to go over threshold. Let's say you're not doing it as an assessment, which is kind of like the example I gave before, but more like, we're going to come back before you start feeling uncomfortable, and we're going to give food while you're waiting. Of course, you can't give food for the whole time forever, right? Because at first, maybe if you leave for 5 minutes, the tongue will last. But if you give the food and you leave for 2 hours, at some point the food has to run out, right? Otherwise, the dog would be like a huge dog,
A happy dog, though.
right? So it's not sustainable over time. So let's say you give a food, food related that lasts for 5 minutes, and then you are going to come back at 10 minutes because that's within your training margin. When the dog finishes the food, it is more likely, most dogs will be humped up. They're going to be more excited, and they require even more tools, or to fine tune their tools
That makes sense.
even more to relax. And to, I can deal with this before tipping over anxiety. And so it's much easier to teach them to actually relax during an absence. So instead of having to work extra hard to develop these tools, let's put you into this mode that you're super relaxed. This is nap time, which is going to make it easier for them to remain in that mode while you are increasing that absence duration. Now, of course, you can give food prior, and that's something that a lot of people do. They do sort of mind games or mental games. They do different activities, so the dog really puts all their focus on that hours prior, and then they do their training, and they have documented that it really helps, that the dogs in their cases tend to be more successful afterwards. But that's kind of a separate story. Now, to finish with this, because I know this is like a lot of different things, but if the dog doesn't suffer from separation anxiety, I have worked, for example, what we mentioned about adaptation. In those cases, I have tried food and see how it works. Yes, the order is incorrect, but since the dog isn't panicking, I have felt, well, maybe we could try and see, let's see what works and what doesn't. And the beautiful thing is that since we have a camera, we can test it out. So one day you give a food toy and then you leave and you see how it goes. And another day you do it without and you see which one works best for your dog. For some dogs, it's great, it works, and they go to sleep. Really, really helps. For some dogs, they get too excited and it's hard for them to then like slow down. So we don't use food for those dogs, and we just customize it depending on each case, basically.
You beat me to my question before I could ask it, so thank you for that. But I do have another question, in the sense of, if you give a dog something that's not a dog that doesn't show separation related issues, if you give them food and you leave, but they will not eat it until you get back, does that suggest they do have some anxiety?
That's a great question. And we have found that there is a big percentage of dogs without separation anxiety that also display anorexia or not eating when they're alone.
Eating might be a social behavior. That's cool.
Definitely.
Wow.
Definitely. So, and it makes a lot of sense, right? If I put the food for my dog downstairs and I come up upstairs, she's not going to eat it unless it's something very tasty. But if it's like kibble, there's no way, because she doesn't want to eat alone. And I think that makes a lot of sense. Yeah, I love that. I love that.
So it doesn't automatically mean that the dog has separation anxiety. It just means maybe he wanted somebody home to eat at the same time he was there, like the company, the social part.
The most important thing, and this is what I always tell my clients, is you have to observe the body language of the dog while the dog is alone. That will tell you what is happening. If your dog has displays excessive greeting and people get scared, they feel, oh, my dog is 10 minutes screaming when I come back, so must be in distress when I'm gone. We first observe what happens when you're gone, because if the behavior only happens when you come back, but the dog sleeps through the whole absence and doesn't care at all that you're gone while you're gone, it's not separation anxiety, and we have to deal with this differently. But and the same goes to for food. If the dog is just relaxed and napping, it means it's not separation anxiety, and we have to deal with it differently. Yeah.
I have so much to digest after this conversation.
That's great. I love it.
Oh, and of course, you can get creative and add food afterwards. So let's say you work on separation anxiety and you have reached more than an hour, and there are some situations that you feel might be benefit from food. There's noises outside or whatever it is, that you might feel that you need to introduce food in the equation. You could do so at that point, because it's a different situation at that point, right? The dog is not panicking anymore, and you're sort of trying to focus on other aspects of your training. I had a client once and we didn't get to do it because unfortunately, sadly, the dog passed. But before that, the challenge we had is that the dog would follow the guardian to the door and would bite her legs. And he was a tiny little thing, so it was okay. And she was amazing because she would tolerate it as long as he was fine. But of course, that's not the ideal, right?
Not healthy.
And he would like, and then she would leave, and he would like, okay. He had separation anxiety, but we had to work our way to him being able to be for a good amount, like 10-15 minutes alone with her, driving away. All was good. But that behavior wasn't decreasing. And so at some point at that point we started thinking about food, but for that context, maybe a remote feeder that we could introduce, and pair it with I move, and take it like separate this piece of the equation. And so we focus on also working on the moving towards the door. And every time we move to the door, there is this thing happening on the other corner of the house. And we started working on that a little bit, not with a remote feeder, but just with her approaching and feeding the dog in a certain place of the house. And it kind of started to work, but then of course the dog sadly passed, so we can't continue. But those are things that I would consider, right? If we need to fine-tune whatever it is happening around the separation anxiety training.
And where I'm loving this conversation is going, we did a podcast about resource guarding a few weeks ago, and we just talked about how like this is our jam. We love dealing with these cases because we understand it completely. There's been a lot of cases that I've gone on where they called me on for resource guarding and it was meeting a dog's need. And what you just described is you show up on a case, the ins and outs of separation anxiety, so you can easily address that factor. And if that's not any other things, then I can help them with all the rest. It's just another example of how there is no one way to train a dog, and how, work with your trainer's specialties is probably the best route forward in a training plan. It's just, I have so much to swallow.
There can't be,
follow-up question?
well, I was going to say, there can't really be one way to train anything because there's so many variables, so many different people, so many different dogs. Everybody has a different personality and a different learning mode, and it's just, there are too many variables. So as experts, we need to have all those tools in our head so that we know when to pull out which one for which client, and even to know at what stage to pull out what tool. Like Moira was saying, later on, they realized they could use some food and it was going to be okay.
Different circumstances, life circumstances that can change over time, and different everything. We're both the dogs and the human side of things. We're living, breathing beings, right? Like we're different, and we need to. I mean, the foundation might be the same, but we're all different. The dogs as well. So we have to be able to be empathetic and to actually listening to what they're saying, because sometimes I think that the biggest mistakes I've made is when I actually didn't listen, really listen. I was listening, but I was too quick to implement whatever it is that I believe it was okay, and I didn't listen. I didn't read in between the lines to what they actually needed or what they wanted to say. And I think those have been my biggest mistakes. And if we continue to work, and it doesn't have to be perfect, but if we continue to focus on listening and understanding and meeting them where they are, we're more likely to be successful at the end. And collaborating, what you were saying, Kelly, is just so important. I don't know at all. in anything.
Nobody does, yeah.
So we need to work together. And sometimes there are parts of this equation that start to come up that are like, well, that's not my side of things. Like, I don't know about this. And working together, we can really optimize the results, because we can work from different angles and really help the family thrive, which is our ultimate goal, right?
It really is. Yeah, it feels
That's
good.
awesome.
All right, that is awesome. So and Camille, I know you had a question about medical, like just how to call in a vet. Do you want to bring that?
Yeah, well, I think when I think about separation anxiety, and of course, every case is different, but there are some clients that I'm like, oh, I really think we might need to talk to your vet first before we even start training. Do you, Moira, how do you feel about those kind of cases, or how do you decide, being a doctor yourself and knowing the medical side of it, how do you decide the emergency of medicine, I guess you'd say? Like, does this dog need it? Does this dog not? Do I need to tell my client to call someone?
That's a great question. And the first part of it is that mostly I have to say that when people get to me, a lot of them are already on, not the person, well, the person maybe, but the dog is already. I don't know that. I don't know. They tell me afterwards, maybe after a while.
Whether you want to know or not, you'll find out.
That's right.
Probably find out at some point, but aside from joking, many of the dogs, I would say maybe 50% of the dogs that reach to me are already on some kind of medication. And so they have already had a conversation with their vets, and they might be on something situational medication, or maybe on a long-term daily medication. But in general, what I would say is that medication is a great way to support any case of separation anxiety. Even if it's not separation anxiety, sometimes the circumstances around, sometimes the dog challenges regarding anxiety in general, adapting to a new situation, noise sensitivity, they will need some support to thrive. And so it's totally fine to think about medication. And our clients tend to believe in many cases that medication will really change the personality of their dogs, or the medication is going to have the dog sedated most of the time. And in this particular setup, so in separation anxiety, that's not what we're seeking. We're seeking a medication that allows the dog to tolerate the situation better, to support them through the learning process. So we don't want them to forget. We actually want them to be conscious of what they're living, but being able to process it better, to increase their threshold so they can understand and cope with the situation better and learn from that experience. And so if it's not making them feel good, it means that it's not the medication for them. And that's the first thing that I talk to my clients when I explain this, and when this conversation comes up. And that's something that I believe all trainers can do, because you're not really talking about any medication, or you're not giving advices exactly or in particular for that particular dog. You're just providing information around how important medication is as an aspect of this training implementation.
Yeah.
I always like to talk about 3 pillars of separation anxiety training: the training, the suspension of absences, and the medication. And
Wow. Okay.
I normalize it from the start. So when I explain how this is going to work, I explain these are the 3 pillars, and I explain that medication isn't a must. The other 2 are. However, I want to bring it up at the beginning, because we may need it at some point, even if we don't need it at the beginning. And I want them to start like thinking about it and processing it, and ask me any questions they might have, and come to peace with it if they are not feeling comfortable. Many people already feel comfortable with it, and they just want to help their dogs, but just in case. And the other aspect that I want to cover was when. So when do I maybe are more likely to bring it up with more force than just mentioning it? I would, if I see that the dog has many challenges at the beginning. I mean, before I have started training, I mention it with more force if I have seen that the dog suffers from many different challenges. So if the dog has generalized anxiety, has aggression issues in any particular way, noise sensitivity, confinement issues, separation anxiety, I would think that that dog is dysregulated somehow, and that we need to support him, probably more likely with medication than just with training. And if the person isn't open to do it right away, what I do say is, let's start training and let's see how our trend goes. If we find many people want to start at the beginning, and that's great. Some people actually want to start medication a little bit before they start training, so the medication has had time to sink in before they start doing training, which is perfectly fine. Most of the time I start at the same time. If they're not open to it, I say, okay, let's see a couple of things. If we see that our training isn't making any progress, and progress can be very slow, but if it's actually really slow, so the trend is stuck basically, and no matter what we do and how we tweak things, it stays like that, it means that we likely need some help. And the second main parameter that I pay attention to is if there's inconsistencies that don't respond to anything that I can pick on. So if the dog does great and suddenly he doesn't, and then he does great and suddenly he doesn't, and we don't see that it was because the dog went to the vet or the dog wasn't feeling good or it was a bad day, but rather nothing that we can understand, then probably that dog is a good candidate for it. And with all that, those are all things that any trainer, no matter if they're vets or not, can do, right? They can assess that. And when you feel like the dog would benefit from this, what I would suggest as for all trainers who are listening is to try to get in touch with the vet. And the way I do it is I just write a letter to them. I ask them in my contract or in my form, when we start working together, if they're cool with me sharing their information with their vets to help the dog further. And I ask them, do you want me to write a behavior report for your vet so we are in touch, so the vet knows that we're working together and the vet understands what's happening? And yes, I provide recommendations to the vet because I am a vet, but you don't have to do a specific recommendations, but you can say, I am reaching out because I think it would be a great idea for you to analyze the situation and decide if it would be a good idea to, proceed with any extra support for this dog or any extra help, or if the dog needs any extra exams or any extra anything. And then from there, you can just start creating a relationship with that veterinarian. The only big consideration I would make is that if you write a behavior report, make it short. Very short. And
Good call.
bullet points. I had
Yep.
Elise Christensen in one of my webinars in my platform a while ago. And I remember her showing a letter actually. And I found it beautiful because the seminar was meant for trainers. And she created a letter that really highlighted the parts that would be important for a vet to know. And all of the things were actually correct to do as a trainer, that wouldn't really step on anybody's toes and was perfectly fine, because trainers are the ones who see the dog every single day. So of course they know more than a vet who sees the dog for 20 minutes. It's obvious and it's fine. As you can present things in a respectful way that isn't crossing any boundaries, but make it short and one page because otherwise nobody's going to read it and the dog is not going to benefit from it.
I've heard several people say that, and I think it's so important. We've got so many things we have to read and do these days, and so many clients to help, and we got to keep it easy for our collaborators, I guess.
But there was something you said, Moira, that I'm curious about the contradictory of it, in the sense of, we want the medication to make the dog feel good, but we're also aware of associations, right? So my question, I have questions about situational, and I also have questions about SSRI, or like more long-term. About the SSRI long-term, my question is more about the loading period. Because if you start a training plan around the same time you start an SSRI, isn't the first 2 or 3 weeks a little touch and go for some clients?
You will. So I usually work for 2-week program, 2-week subscriptions that renew every 2 weeks. So in general, it's 2 at least. That there are 2 periods that are still they're at least going to work with me. So it's like 4 weeks. So yeah, it would be a little bit, if we start at the same time, they may not be seeing a lot of changes while they're working with me if they don't continue afterwards. But a lot of people tend to just, because they just want to start, and I am totally cool with it, because the training in itself is still going to help. It's not that training is not going to help. We're not having the dog exposed to being left alone over their what they can handle anymore. So everything is in a way conducive for the dog to succeed, and it's still going to take time anyway. So I don't feel it's a big deal, but I definitely honor when the people makes the choice to wait. I totally honor that, and I usually suggest that if that's the situation, that they stop leaving the dog alone while they are starting the medication, and they have all of that on board and ready. So when we start working together, the dog has had a period of sort of relaxation and to bring it all in. And with the long-term medications, as an SSRI, for example, yes, the usual is to say we're going to see changes after 4 weeks, like solid changes that we can really grasp. But you might start seeing things earlier on. It's nothing official, right? But you might start seeing certain things change, and it's also a good idea to start seeing if there are any side effects, if you have to switch things around. So I think the answer, there's no right or wrong. I think it really depends on who wants what.
Fair enough. And then for the situational, then if they're doing something that we just know we're going to be gone at this certain period of time, are you giving them situational daily so that they don't create the association that I'm going to feel dope before mom leaves?
That's a very good question, because I'm having a case like that. So it depends, and that's a typical answer, right? It depends. So situational can go on its own, or it can go on top of the daily medication. It can be situational, or it can be given daily. It really depends on the dog. It can be many different ones together, and it can be just one. If you find a medication that doesn't make the dog feel in any way different, sedated or drowsy, you might get away with just giving it prior to your training. And with training, I think it's important to make the distinction that I don't use situational medication to cover absences that aren't training, which is something that is a common practice, and that I know a lot of people still do that. I prefer not to do that unless it's a real emergency. I don't like to offer it as an option as well, because when you offer an option, then people take that option. So, and so because that medication has a different purpose, which is sort of numb the dog so the dog is able to tolerate the situation that's going to be very, 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 very bad and uncomfortable for him. It's not to cover training, to make training easier to handle. It's a different concept. So for training, I would prefer to have something on board that doesn't really numb the dog, but rather helps the dog to tolerate this better. Sometimes there will be a little bit of sedation, or not sedation, but a little bit more sleepiness, if you will, and the dog will be a little bit more down, if you will, and you will have to balance the pros and cons of that. Sometimes doing daily can be a good alternative, and if the dog is if you don't know when you're going to do your training, or if it's just too complicated to organize everything. But if the dog is having side effects due to having it every day, and you are starting to see that the dog mostly sleeps all day, every day, maybe that's not what you want, because it's not improving the dog's quality of life. So you have to really balance case to case. I've had a case, I'm working right now with a case where we have been realizing, because we have now the third drug, I think, third drug, situational drug, that we have tried that creates the same side effect, which is the dog seems okay with the medication, so the dog isn't showing any very overt negative side effects. However, we know that she might be feeling different, because when you do missions with that medication on board, she reacts very badly. And as soon as we have been trialing them. So every time we finish trialing one, and we have a kind of a washout period, even though you don't need technically a washout period, but we just do it for the data. She bounced back and she's totally fine. And then we try the other one, and so and it happens the same. So we believe that she is feeling out of control. Because imagine, and that's the way I like to picture it. Imagine if you have something, you took a Xanax, I don't know, and you are feeling more calm, but you're feeling a little bit weird and out of control. and then you're presented with something that you should be very, very alert to, because it's dangerous potentially. So you have to be aware, but you can't, because you're feeling like you're like, "Ooh," you know, like if you were drunk, you're probably going to be even more stressed, because now you can't even control the situation, or be able to navigate it in the best way. So we are thinking that in her particular case, that's what's happening, and that she does better when she is in control over the situation. So as you see, there's so many different variables to consider in those aspects, and working with a vet who's knowledgeable about behavior, or with a vet behaviorist in collaboration, it's such a great idea, because you can test all of these different things. And if you have a data tracking sheet, you can really help them. That's what I usually do. I don't prescribe myself, but what I do is I provide all of this information. So every month, or whenever it is that they're checking in, I send them an email. I said, yes, this is what happened when you use this happened. When we use this happened. And they have all the information there to make the best decision, rather than just information that is more like, just less literal, less clear, and less connected to the events.
Well, all of our clients want to be told what to do, so it's really cool that even you who have your own separation anxiety dog.com, like, say you're making the choice. I'm not making it for you, client. Go, this is the educated stuff.
Exactly.
Camille, do you have any follow-up questions? Because I have a few, of course.
Go. Ask. I can't wait to hear them.
Well, because now I have heard multiple vets use situational meds for what you just said we don't ever do, which is dope a dog so that they can handle the separation.
Yes.
So yeah, please.
Isn't it?
Yes.
I was just going to say, isn't it more about giving them medication, not so they can handle the situation, but so that they can learn to relax in that type of situation?
A different association, essentially.
Definitely. And I understand the value of having that tool in case we need it. The only thing I try not to fall into is, and that I have seen happening, is to using too much of our time and trialing things that would potentially work. That very rare situation when we have an emergency and this happens, rather than putting all of our energy on using something that allows the dog to learn, and that we can focus on training and learning and teaching and making progress with the dog. So I see the value in it. I just don't, I prefer not to get stuck on trialing without making progress. For example, with this particular case I was mentioning, that's even with this, the guardian said it, like, I feel like we are trying things, and that is actually making our training to get stuck, because every time we try something, we go back down, like we go downhill. And we're lucky that at this point the dog is not really regressing badly, but she is bouncing back and doing good every time, because we could create a regression. Basically, we could trigger a regression by doing so, but we haven't, luckily. But she realized this is not something I'm comfortable doing anymore, because I prefer to focus on our training. But you have to balance things, because of course, if you feel like you will ever need something, even during the training, if you need, with that particular client, at some point I may need more medication if we run into another regression, or get stuck in something else. And what do I use if we haven't tried anything? So it is still good to have that chance and those options, but yeah, not focusing on them more than in the training. And the problem with doing those trials is that in our case, we were doing them while we were training. So we knew that the dog was still safe, because we were doing them in the context of training. But if you do them just as a trial, I'm going to just leave your dog alone and for 30 minutes and use this med and see if it worked, you're putting the dog over threshold every single time you're trying a different medication. And that's not really helpful for the dog. So you have to think about that and really find a way to make it so the dog isn't in more distress than you need him to be.
It feels like this is a conversation over if lures are useful. because a lot of people like using lures, they get the behavior quickly, but then fading it is like a whole finesse thing. So it sounds like you're saying this is a tool that I absolutely use, but I don't need to use it immediately because I don't want to tie my hand behind my back if I need it in the future.
Yeah, exactly. Yeah, I think so. And usually once you are training and you have implemented training, you can try all of these things as we have with this particular client. For example, we can trial them in a safe space rather than just exposing the dog to an assessment, if you will, just by trying different things and seeing what works. I don't believe that it's very healthy for the dog, but I know it's a practice that is done, and I understand the value of it, but I personally wouldn't suggest doing it, or I wouldn't recommend doing it at all.
That's the hard part. I mean, there are so many different times that I hear techniques and I'm like, yeah, I could see that being valuable, but am I using that technique? No. Like, yeah, fair enough.
Exactly.
All right, so we are coming towards the end, but I have two more questions for you. One is, what are some factors that you consider that might have the most um impact for a successful prognosis?
That's a good question. Let's start with the factors I would think wouldn't.
That's helpful. Yeah, no.
Good prognosis. I'm not wanting to be a negative person, but I think that's
Helpful.
easier. It's
Mhm.
easier to address it from there on, from that point. So similar and connected to what we were talking about with the medication, I think that when the dog suffers from other challenges as well, so all their behavior challenges such as generalized anxiety, aggression issues, confinement issues, noise sensitivity, likely the prognosis, and I don't want to say will be, but it could be less good than if the dog only had separation anxiety. With prognosis, I am not, by the way, saying that it's going to take less or more time, because that doesn't have anything to do. So you can have a dog who only had this, everything else was perfect, it looks super simple, the signs or the behaviors weren't very intense, looks easy, I'm going to take that case. And it's not. And it takes a long time. So, and it may be smooth, but it may be slow, and it might take a long time. Whether a case that looks horrible and you're scared, it's like, no, I'm starting to do cases like this, I'm not going to do this because it's too hard. It might be much easier in the sense of how long it takes. So don't really get caught on that. There is no correlation, but prognosis in the sense of how easy it's going to be to resolve it and to continue working on it until it is resolved. So the more challenges you have, the harder it is, right? Because not only it's very time consuming and emotionally consuming for the guardian, but it's also hard to manage. Because if you have a dog, you have to manage absences, but the dog can be with other humans, can be with other dogs, can be taken by a dog walker, can be with a pet sitter, because the dog has aggression issues with all of those. It makes it harder for you to manage the absences and to have a life and continue to work on separation anxiety for 2 years or whatever it is the dog needs it. So that will definitely impact your prognosis. If the dog also has noise sensitivity, let's say thunderstorm phobia, every time that you have a season of storms, the dog will likely regress. And so it will get harder for you to make progress. You will have to suspend. You won't be able to leave the dog alone if there's a storm, even if the dog is okay with a certain amount of time. All of those things will affect your prognosis. The life circumstances of the person. If the person lives alone, if the person moved to a new place where they don't know anybody, they don't have a network, a community, supportive community that can help them with the suspension of absences, they work office hours outside, there's no way they can work from home. All of those things will affect the potential for suspending absences, and then the prognosis will get affected. So I believe to turn it around, what would make it easier, if you will, not easier, but likely a better prognosis will be a dog who only is showing signs of separation anxiety. All of the other things are easier. The dog is friendly with other dogs. It's easy to manage everything else. The family has a great network that can help them with, and that they have the patience to continue to work with their dog. I think and that the dog is consistent. I think that would be a big one as well. because there are many dogs who have this, what we were talking about, inconsistencies that you can't really connect to anything, and that definitely makes it harder because you first have to find out what's happening, and sometimes it's not easy. So that definitely makes it harder.
So the dog must be 3 years old at least, is what you're saying. Got
Or but there's always a way, and I would want to stay with that, and for people not to feel sort of disappointed and helpless. There is always a way, and there are a lot of different plans. So as letters we have in the alphabet, we have plan A and B and C and many more, and as long as you don't run out of ideas, you can continue trying different things. I had one client who I still am working with, who once asked me, we have been together for a long time. We have been together for more than 3 years now, and they're at 4 hours, which is amazing. This is a very hard case. I have actually a seminar in my platform of this dog, his case, because it allowed me to develop new ways of training, actually different schedules and protocols, just because of him, that were very helpful. And then I have been using them for other dogs as well. But once I remember she asked me, do you think we'll ever get there? And if so, how long? I know that we can't ask, but you said, she asked, do you think it's, I don't know, it's going to be 9 years? And I said, well, if it's 9 years, I'm probably going to tell you, I don't know what else to do much earlier than that. So don't worry about it. So I'm not going to lie to you. When I run out of ideas, I'm going to tell you. But for now, for today, for tomorrow, for the next month, I have another idea that we could try. And that was when we were maybe stuck at 15 minutes, that we had been stuck for a long time, and that was 4 hours. So there's always a way. You just have to keep going.
Excellent. Excellent. I like that.
That is a dedicated client to be with you for 4 years. That's awesome.
Right.
It's amazing.
All right. And then the last one that we're going to start asking every guest, which is,
Yes.
when you think about all the crumbles, the different components that go into dog training that make up the whole cookie, what crumbles do you think get ignored the most or put on the back burner and need to be discussed more?
I think that's a beautiful question to wrap up, because it touches on things that we have been talking about during this interview, which is first to listen. I think that would be the first one. I think we underrate the importance of listening, both the dog and the person behind the dog. And on one hand, to be empathetic with the person and with our own selves. I think that is one part that we kind of forget about it, and we just want to help, and then we get mad when things don't work out. And I think it's a combination of not listening to what the other person needs, but also not listening to our own needs and what we need at that time. Understanding that we have to set ourselves up for success as well as the client is very important. It has been, for me, it has been a long ride to learn that, and with ups and downs, and a lot of middle-age crises have happened during that time. But I think that's very important. I think it is important to cut ourselves some slack and be kind to ourselves so we can help others. And in the second big crumble, I think that we need to look more at is to teach, because it's not that the person wants to harm their dog. I don't think anybody wants to harm their dog. I think everybody wants their dog to be happy and healthy, and they love them. They just don't know. They don't understand. And there's so much information out there that tells them that this is a bad situation and that the dog is breaking their things and it's not allowing them to be happy. They can't go out to, for drinks. They can't date. They are alone. There are so many things that are happening. They can't take their kids to school because they have to stay with the dog. There's just so much pain behind it that it becomes just an anger issue, where the dog is bad, and all of the things I read are this dog should learn, right? So teaching them that this is a process, and that the dog is actually suffering, and that the dog we are all they have. They don't have anything else. We are the highlight of their day. And it's not that they're doing it to hurt us. They're doing it because they don't know what else to do. And they're hurting, and they're looking up to us because we can solve it for them or because they need our help. So understanding that, and it's our job to teach or to educate clients about that, instead of getting mad at them because they don't know. It's our responsibility. That's what we're here for. And our kindness can impact that. Our kindness is contagious. And if we are kind to them, we can teach them how to be kind, in the sense, kind of meaning empathetic with their dogs as well. And even understand that later on, this is not something we resolve. It's done. You graduated. It's okay. You still have to continue to set up your dog for success, because your dog is going to continue to have things that are harder for them and things that are easier for them, because they're beings. they're not a math problem. And continuing to support them is going to really allow them to thrive, and it's going to strengthen your relationship with them. So that would be my main focus if I couldn't do anything else.
I'm not crying, you're crying.
Yeah, that was absolutely beautiful. I love that, Moira.
But it applies to all the different, not even the separation
Yeah.
anxiety cookie. It's every other cookie that we're in the dog. I think that part of the reason Camille and I created this podcast is because we got so tired of going on social media, seeing things that we want to throw the computer for. And instead of just putting it into the arguments already there, we're just going to start creating our own stuff that doesn't have that. So that was exactly
that acknowledges all the differences and all the little
Yes.
cookie crumbles that go into
Yes.
making the whole thing, because there are so many. There just are.
I'm proud of you guys. That's amazing. I love that. Be the change you want to see in the world. That's all about. It's all about that, right? Yeah. If we don't start, who is going to?
That's right. Exactly.
This was awesome. I guess there's one final question, which is, Moira, do you have anything coming up that you want to advertise, that you want to let people know about?
Not at the moment. I will let you know if I have anything, so you guys can help me spread the word. But for now, I'm just really focusing on helping clients, and also in helping through all the different courses and webinars and programs that I have on my website that can also provide more variety depending on your, financial circumstances, and there are also different options there for trainers as well. I do have an affiliate program for trainers to have more opportunities to provide help to their clients, but also using this program as another tool in their toolbox, basically. So all of that, and I will let you know when I have more things coming up, definitely.
Are you going to be at the foundation? I think, Camille, were you going to ask the same question? Are you going to be in Nashville?
No. Oh, no. Actually, I just wanted to say separationanxietydog.com,
Yes.
which is Moira's wonderful, wonderful website. I was going through it in preparation for this and found so many just great information and videos and just a lot of resources that were great. So separationanxietydog.com.
We'll put that in
Just
the
wanna
link.
throw that out there.
I do have a newsletter that I have taken a little bit break during this last few months since I was traveling, but
Oh,
I'm
nice.
sending a monthly newsletter with a lot of thoughts and a lot of different things for people to subscribe to. You can subscribe to the same website, and it's free. It's just information and my musings and thoughts about different things that could potentially help you and make you help you feel inspired about this.
Oh, I love that.
Yeah, thank you so much for doing
Definitely signing up.
All right. Well, thank you so much for joining us today. This talk was amazing. And
Oh, it was. Thank you so much for all the fantastic information. Thank you so much for your time and for being here with us. It's been a blast.
For having me. I had a lot of fun, and I'm not crying, you're crying.
Exactly.
So to close it out, I think the theme is be kind to your dogs, be kind to yourself. Have a great rest of your week, everyone.
That is perfect. Thanks everybody for being with us.